Good afternoon, everyone. Today's session is going to be really helpful and it is led by Dr. Rima. She is going to talk about breast screening and its importance. So, stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Dr. Rima, you have the stage.
Hello everyone, I am Dr. Rima Agarwal from Apollo Cradle Hospital, Indrapuram. Today we will be speaking about a very important topic which is very relevant in nowadays, which is breast cancer. Breast cancer screening and what is the importance of breast cancer screening. So as we all know that breast cancer is the leading cancer in females worldwide. Few years back, cervical cancer was a leading cancer in India, but now breast cancer has taken over, and in India also, the females, breast cancer is the leading cancer. So you have before the age of 50, every female has a risk of at least 12% risk of having a breast cancer, and after the age of 50, you have a 22% risk of having breast cancer. Most of the females are seen below 40. There's 48% of the cancers occur in females less than age 40, but after 40 years and 50 years the risk increases, and 50% of the cancers in female is diagnosed after age of 50. So breast cancer has become very important and the most important cancer in females, though this cancer occurs in males also, but very less, but it does occur because males also have breast tissue. So what is breast cancer? Breast cancer is the cancer cells growing in the breast tissue. The breast tissue has fat, fibrous tissue, and glands. So usually ductal glands, which are mammary glands, they develop cancers. So now we have to understand that breast cancer is common. We have understood that. The most important thing is it can be screened. Screening means detecting the cancer before it has fully developed, before stage 1, early detection. And early detection of any disease or especially cancers can increase the survival rate, decrease mortality, and hence screening is must. So screening can be done. Ideally, every lady should do the screening themselves. Firstly, we can do the screening on our own, and secondly, there are certain methods, certain tests which are used for breast cancer screening. So first, let me tell you what are the symptoms which are required, for which you should be alert, and then you have to examine yourself and consult a doctor as soon as possible. So breast cancer can be asymptomatic, there can be no symptom at all, or you can feel a lump when you are doing self examination, which I will talk about later. So you can, the symptom most commonly seen is lump or any swelling in the breast, either both breast or one of the breast. Secondly, patient can have some amount of pain, heaviness, and tenderness, like touch karne se pain hona, these things in the breast. Then uneven sizes of the breast, suddenly patient realizes that one breast is growing bigger than the other. Then any discharge from nipple. Sometimes it can be milk, it can be water, it can be pus or blood mix. Blood mix discharge is very important. Then you might have some changes in the skin overlying the breast, like redness, flakiness, or some dimpling like an orange peel. There can be dimpling on the skin. And one more important thing is retraction. Nipple gets pulled inside. So these 5 6 symptoms, they are very important, which you have to look for, and if you have that, consult a doctor. And now we have to see what we can do about it. Those who are not having any symptoms, screening is important when there is no symptom. Once you have symptoms, this means the cancer has grown. Now we have to detect it and treat it. But the importance of screening is diagnosing the cancer before it has become big enough to show the symptoms. So let me tell you about the risk factors also now. What are the risk factors? So risk factors more important is obesity, excessive weight gain, young age, adolescent, or after menopause. If you are overweight, then you have slightly higher risk of having a cancer. Then alcohol, excessive amount of alcohol intake, smoking, they also add to the risk of having a breast cancer. Then those who have never had babies and never breastfed, these patients also tend to get more cancers than those who have breastfed their babies and had babies. Then Another important thing is early age of menarche, like you have started with your periods at an early age, and menopause is also late. So the menstrual cycles have been there for many years. That also can contribute to the risk of developing breast cancer. And one another thing is hormone replacement therapy. Those who are on HRT, estrogen based HRT, for a long time in their perimenopausal or postmenopausal period, those patients also are at higher risk of developing cancer. So there, now we know the all that. In this, what is the screening test available? First and most important, though it is not a test, it is self-examination. Every female should know how to do a self-examination of the breast, because at home you can do it with your own hands, and if you are okay with that, if everything is fine, then you don't need to panic. But if you diagnose something, then you have to consult the doctor. So first thing is looking at the breast. In this, you have to stand in front of a mirror with your hands on your hips and look at the breast. Like, you have to examine your breast by looking at them. If the sizes are varying, if they are swollen, they are big or small, then any discharge from the nipple is there. Then put your hands up above your shoulder and then again look for the symmetry, size, any swelling, or any nipple discharge. And then you have to lie down, and with the left hand you will do the examination of the right breast, and with the right hand left breast. So use your middle three fingers, and you have to touch the breast from the fat pad, not from the tips. So this thing has to touch. So you have to just go clockwise from the breast, starting at 12 o'clock and then going the whole way and pressing with mild pressure. With applying mild pressure on the breast tissue, you rotate your fingers and cover the whole of the breast in a clockwise manner, and try to feel for any swelling, any lump, pain, thickening, knotting, and in the breast tissue. And lastly, just squeeze the nipple and see that there is any discharge coming out or not. So this is a very easy method and can be done at home. And once you have done one side of the breast, then do the other side, and also go for the axillary examination. You have to go again with those fingers, reach out to the axilla and palpate the whole of the axilla, to see if there is any lumps felt in the axilla or not, any painful lumps or not. Then we now this is the self examination, which is very easy. Once you know the technique, you can do it. You can do it while taking a shower, you can in the bathroom, every week you can do, every month you can do. And whenever you find any irregularity in the examination, you have to consult your doctor. So next comes is the mammography. Mammography is the most important screening test available. It is basically an X-ray of the chest. It is X-ray of the breast. Sorry, not chest. It is X-ray of the breast. So in this, radio X-ray plates are applied on the breast, and then serial X-rays are taken. And according to the density of the breast tissue, it is seen whether there are any uh, early signs like freckling, some calcium deposits, some white marks seen on. So the radiologist will report it according to they have certain definition by that's 1, 2, 3, 4, and it is reported like that. So it is easily done and non-invasive technique है. कुछ उसमें कोई वो नहीं होता, बस जाके एक्सरे कराना होता है. Not time consuming, not invasive, not painful, nothing. And a mammography can detect very early stages before the cancer tissue is big enough to form a lump or cause secretion or pain or anything. Before that, it can detect the development of cancer कि इस patient को cancer हो सकता है at a very early stage. And if it so screening करने से what is the importance, what is the benefit we get? So it can, because of the early detection, you can find out the cancer early and then treat it. Almost it is completely treatable if it is detected very early, before it has spread to a major area or throughout the body. The cancers can be stopped. So it is seen that if we detect the cancer early by mammography, then the 5-year survival rate of the patient is 100%. And in various studies, it has been shown that there is the survival rate of the patient if after screening, matlab if they have been screened and detected early, then it increases very much over a period of 10 to 15 years, and it has decreased the death or mortality of the breast cancer patients in as much as one third. Like 30 to 35% of the patients were saved if they went through screening and they were diagnosed as cancer, rather than those who had a disease and came for treatment. So this is the importance of screening. So when it should be done, it can be done at any age, but it is regularly recommended for females more than 40 years. From 40 to 55 years, it is recommended that they go for the every year mammogram. Yearly mammogram should be done, and any changes, if noticed, then they should be reported. And more than 55 years, they can do skip a year and take it every 2 year. So every 2 years after the age of 55, and between the age of 40 and 54, every year one should go for the mammography. And as it is seen that people think that family history plays a very important part in breast cancer की जिनकी family में है, mothers को, sisters को and all that, they are more at risk. No, everybody is at risk. And in fact, it is seen that out of 100 breast cancer patients, 75% had no family history of breast cancer in their family. So, breast cancer screening mammography is recommended to all the females, and especially in younger age group, because there the incidence of cancer is high. And if it is detected at a younger age, like less than 50, then the survival rate increases very much, and definitive diagnosis and treatment can be done at a very early stage, because one of out of six cancers occur between the age of 40 to 49, and then it increases every year. Your risk of having a breast cancer increases. So the beauty of this is that breast cancer, though it is the leading and most feared cancers in females, it is one of the most common cancers, but still it can be detected very early and treated almost to 100% if detected early. So the your long term survival rate is very good if it is detected at stage 1 or before that by mammography. And screening is available. Screening first you can do at your home, and after the age of 40 go for the yearly mammography, and hence we can fight this cancer by a simple screening method, mammography. So the take home message is, if you are 40 and above, go for mammography at least yearly, and self examination every lady should keep on doing at least weekly or monthly. If not weekly, every month one should examine. It's very easy. While you are taking bath, you can just have a look at your breast in the mirror, or whenever you have time, just lie down, feel the breast tissue, and I've told you what to look for. So, with all these, we can fight breast cancer, and by diagnosing it early and treating it to the best. So, any questions for this? If you have any questions, you can put it in the chat box. Okay, so I think there are no questions as of now. So you can just watch the video whenever you have time and put in the chat box. I will try to answer it. So, okay, take care, be healthy, stay safe. Thanks.